So to get started, I want to introduce Jessica Orenstein with Jed. Jed, like I think I mentioned in the beginning, Jed is a new partner with us. And we've had a couple conversations with Jed, and we just found that their work is kind of incredibly spot on and interesting for us. And it's kind of in an area that I would say that we just haven't had a lot of financial support in, or the ability to provide financial support, and that's kind of in the areas of mental health. And I know Jessica is going to go through and talk about not only what they've been doing even in the state of Washington, but also in other areas. So Jessica joined Jed in February of 2019. Prior to joining the Jed team, she worked in the field of public health workforce development for nonprofit organization in both Los Angeles and New York City. Before gaining experience in the workforce development, Jessica worked in the higher education field, devoting several years to academic, professional, and personal development of new and first-year students at St. Louis University. Jessica grew up in the suburb of Bellevue, Illinois, completed both her BS in Communication Sciences and Disorders and her MS in Public Health, Behavioral Science, and Health Education at St. Louis University in St. Louis, Missouri. And I know, Jessica, you also have a teammate today, and that is Dr. Suzanne Button, and I'm hoping that you'll introduce her to us as you go ahead, and you can go ahead and please get started. Thank you.
Thank you so much. I'm so happy to be here speaking with you all. I'm seeing some familiar faces and names. Hi, Kathy. How are you? It's just really great to be here. I'll go ahead and start sharing my screen, and then I'll go over really brief introductions that allow Susie to introduce herself to you all. So let me just do that really quick. I will not be able to see the chat. So if anybody, we are reserving questions to the very end. But if you have any questions that you don't want to forget in the meantime, please feel free to add them to the chat. So we'll go ahead and get started. This is, like I said, a pleasure to be here with you. Again, my name is Jessica Orenstein. You can call me Orenstein or Orenstein, depending on the area of the world. They're both correct. I'm coming from the higher education field, both public health field and higher education, and I'm just super happy to be here. I know you've heard enough about me, but I would like my colleague, Dr. Suzanne Button, to introduce herself and talk to you about all the great things she's done as well.
Thanks, Jess, and hi, everybody. Good afternoon. We're hoping to make this presentation a little lively. I'm guessing you've been sitting still for a little while, so it's okay to stand up and do jumping jacks, and you can decide whether or not you want to turn off the camera. We will be comfortable either way. So I'm new to Jed. I just started in August, and my role is the Senior Clinical Director for the high school team. So I have the privilege of working with Jess, who's been doing this work for some time. I come to Jed after working in consultation to organizations that serve kids who have lots of needs. I was working at the University of Chicago at an organization called Chapin Hall for a few years as a consultant to schools, departments of health, departments of mental health, departments of child welfare across the country. But prior to that time, I worked for about 20 years, both in clinical and educational programs serving kids, and specialized in children in middle school and high school. Lots of consulting to schools, mostly here in the Northeast, but also a little bit across the country. And also I continue to this day to maintain a small private practice. I live about 150 miles north of New York City in a small town, and I treat middle schoolers and teenagers and their families. So I'm happy to be a part of the Jed team and to be here today. You're mute.
Thanks for that. I was just saying, hey, 2020.
I know.
Yes, I'm just happy to have you on the team, Susie. So let's just go ahead and get started. Again, this presentation today is going over all of our JED programming, and specifically we'll get into some of the programming that we are currently launching through our JED High School program, which is super exciting. And I'll get to that a little bit later in the presentation. So hold your seats, hold on to it. We're getting started. So a little bit about the JED Foundation is that we're a nonprofit organization that protects the emotional health and prevents suicide for our nation's teens and young adults. This is our 20-year anniversary. We're super happy to be here for as long as we have and to have made the impact in the ways that we have. The organization was created, unfortunately, after the passing of our founder's son to suicide. He was a college student at the time, really active student at that, but really struggling with his emotional well-being and his mental health. Unfortunately, a lot of the people around his circle and his support group on campus knew what he was going through. But as we know, sometimes that communication isn't always delivered to the family. And because of that break, and I'm obviously a lot of other things, there were many, unfortunately, he ended up losing his life. But everything that we do to date is to support students all throughout their age groups from 13 to 30. We want to ensure that teens and young adults are equipped to navigate various challenges emotionally and mentally, and are able to enter adulthood in the best ways, and overall really be able to tackle transitions. Even as adults, we know that transitions are very difficult to manage, whether you're moving, whether you are getting married, or whatever it is, starting a new job. Transitions are difficult, and it's difficult for us to manage those transitions knowing that there's some light at the end of the tunnel, right? So can you imagine students who have less life experiences to be able to look forward and say, I made it through this one time, I can make it through again? We want to ensure that students are emotionally prepared regardless of anything to enter a transition phase, and specifically that transitionary period between high school and college, because that's a very difficult time. We also look in seeing how our communities support the overall emotional well-being of mental health in teens. Oftentimes, as you all probably know, in the school setting, a student will go up to whichever gatekeeper they choose, whether that's in the cafeteria or in the counseling office or the main office. It could be wherever. And they're more apt to talk to certain people that they feel safe with, but sometimes they don't always feel safe coming home and having those conversations, those difficult conversations with their parents, or even other people in their community, such as siblings, cousins, other family members, and friends. And we really want to make sure that they're comfortable having these conversations, and the communities that support them are comfortable having supportive conversations with them, and knowing when to refer when that's necessary. So again, our approach is obviously, like I said before, helping students navigate these mental health challenges, preparing students to enter adulthood, or emotionally transition out of high school to college or into the workforce. We're also helping higher educational systems build a comprehensive approach around how they support the mental health of the students that are on their campus. And you'll learn a little bit more later about how we do that now in high school settings as well. So a little bit more about our audiences is, like I said before, is our audience are youth age 13 to 30, but we have, and that's where we actually originally didn't start with 13 to 30. We started with just college students, but we've seen that there's a bigger approach and a bigger need that we feel is within our scope, and that we can really have some impact. And that's why we've broaden our scope to include ages 13 and 30, but not just with direct campaigns or programs for those students, but also working with those students and their families, other community members, their schools, employers, educators, everything. We've worked with media on several different occasions, from just simple Instagram lives on a student organization's Instagram account, to working with Facebook on their Facebook Live, and just talking more about how to thoughtfully support youth ages 13 to 30.
One of the things we want to talk a little bit about, and I'm guessing that you all know this quite well, is that current estimates suggest that when we think about that 13 to 30 age group, and particularly the younger end of that age group, we know that just about 1 out of every 4 young people has a diagnosable mental health condition right now. Now, I want to point out to you too that this statistic, 1 out of 4, this comes from research done before the pandemic. So as you all well know, there is an increased prevalence, right, of depression and anxiety and just stress and distress as a result of what's been happening in our world for the last 9 months. Almost half of those young people are not getting treatment. So that's a pretty chilling statistic. Our mission at JED is to try and help address that. We also know a few things about what does happen when young people feel emotional distress, symptoms of mental health challenges. Just about 76% of them prefer to turn to a peer first when they are in distress, right? And that's natural, right? We know that young people, adolescents and young adults, they have a developmental press to connect more primarily to their peers as they get ready to separate or balance connectedness with families and friends for young adulthood. We also know that when we ask people in this age group, do you know how to recognize mental health challenges in your friends? And do you know what to do when you recognize them or when you're worried about someone? And quite universally, they report, I'm not sure what I would do. And I'm not sure when I see a friend struggling what I should do. Another piece that we want you to think about as we think about our work at JED is some of the resilience factors, right? We know what some of the buffers are to stress, distress, right? Emotional challenges. And two of the most important buffers, two of the most important predictors of resilience are learning life skills and learning self-care habits, right? But we also know that teenagers are coming out of high school emotionally unprepared, right? Not necessarily schooled in the life skills, fundamental life skills, things like money management, how to take care of your health, how to take care of your well-being, right? Nutrition. But 60% of first-year students, when you ask them the question in college, do you feel like you were emotionally prepared for this transition coming out of high school? 60% of them will say to you, I don't feel like I was, and I wish I had been. Colleges are the institutions that we know of that have the largest number of young adults, but most colleges have not implemented best practices for promoting student health and well-being. So we're seeing that sort of struggle both on the high school side and the college side. Jess, I think, is this me still? This one is me, yeah. Okay. So this is, again, I want to point out as we walk through these numbers, this is pre-pandemic, right? This is from a survey in 2018. When we look at and talk to college students, 3 out of 5 tell us that at some point during the year, they feel overwhelming anxiety. 2 in 5 say they're so depressed at times that it's hard to function. 1 out of 4 report that they'll binge drink regularly, not just once, but regularly. And 1 in 10 report that they abuse prescription drugs. And look at this next number. When we get to the young adults who are coming out of our high schools, we see that almost 2.5 million young people say that they've had serious thoughts of suicide. And more than 1.5 million young people have cut or burned themselves, have self-injured in some way. And we know, right, that's a coping mechanism that is maladaptive, but that does really help soothe young people when they're in distress. 340,000 college students report that they have attempted suicide. And among young college-age people, we see that 1,400 a year, sadly, will die by suicide.
So I wanted to go over a little bit more about the college experience and how Susie was saying before that it is rated less favorably by students. And specifically here, we're talking about students of color. Um, and this could be for a variety of different reasons that we're not really pinpointing in this slide or at all in this presentation, but it is something to note so that we could continue to create programming that supports these students as they enter college or even the workforce. But here you could see that overall the college experience is considered excellent or good for the most part. You know, most students are saying they do think that their experience is good. It's just that you're seeing some of those differences across all of these different domains or these yeah, I would say domains in this case. Is a little bit different when thinking about students of color. And I'm going back to just what I said. A lot of that could be prevented if we have more affinity groups that maybe support um, Black students or the Latinx community or the Native American community, because we do know that transitioning over, ideally, what many students would help many students in addition to programming, such as affinity groups, are seeing more faculty and staff that look like them, something that's relatable. When going back to what Susie was saying and how peers will go to peers, it's also true that regardless of even color, we will go to someone of another that has some of those commonalities and similarities to us because it's relatable, it's comfortable, and we share a lived experience. So it kind of helps us just cope overall. So really thinking about these statistics and how to increase programming in your school system the same way that we've increased programming within ours, and the recommendations that we give to educational institutions, whether they're college or high school, are really effective.
So JED comes to the promotion of well-being with 4 overarching strategies. Number 1 is we want to take a look at the mental health attitudes and behaviors among the young people themselves. So when we're thinking about emerging adults, we want to think about 13 to 30. So we want to start young people in high school better understanding mental health, better not stigmatizing mental health, right? We also want to offer that strengthened attitude and behavior to the people who support teenagers and young adults. Our second strategy is direct support for the actual mental and emotional health of high school students and preparation of those high school students for their transition to adulthood. And some transitions are to college, but some are to the working world, to young adult life in the working world. And we want to make sure we're looking at preparing young people emotionally and functionally for both of those types of transitions. Our third strategy is helping systems change across higher education and now high school. And what we mean by that is we want systems to learn how to create change that prioritizes emotional health and wellness and mental health promotion in their systems. And so a lot of our focus is on technical assistance to systems and helping them evaluate and change. And then finally, JED is working, just as we are right now, to improve the field by getting out there and talking about our work, talking about the research, talking about what we know are the most helpful strategies to accomplish those first 3 strategies throughout the field of people who serve teenagers and young adults. So toward that end, we use a comprehensive public health approach. And what we mean by that is that we think about that, you know, you're all, I'm sure, familiar with the MTSS 3-tiered strategy approach, right? We look at that for response to intervention, and we're looking at that here in our public health approach to promoting well-being and preventing suicide and substance misuse. We look at key domains and we use an evaluation and strategic planning approach to help systems look at how they're doing in each of 7 key domains. And the domains themselves are the things that we know provide those tier 1 supports, universal supports for everybody in the high school or college system, or those tier 2 supports, right? Identifying kids who look a little shakier, who look a little more at risk, and getting in and supporting them. And then also those tier 3 supports, right? Kids who we know need additional support and services. How do we get the best of the best to them?
So I just want to highlight very briefly, because we're going to go a little bit more into depth, with these programs. But the JED Campus program really was our flagship program. It was what started, not what started the organization, but what we became very well known for. And this is what we are really, or how we really started taking that comprehensive approach that Susie was just speaking of, and implementing it throughout all different areas on a college campus, from community colleges to four-year institutions. And even now we're looking into graduate programs, because they also need as much help as any other institution, but sometimes they're forgotten children, I would say, at the collegiate level. But this program is a four-year program. Like I said, I'll go over a little bit more in detail, but we have over 300 different colleges and universities that we've been fortunate to work with through the JED Campus program. And then Set to Go was our first high school program, where we really thought, how could we help students emotionally transition out of high school into college or the workforce? And I'll talk a bit more about that as well. But before getting to that, I wanted to briefly discuss some of our campaigns and youth-facing programs that really help promote connectedness, help-seeking behaviors, self-care, and help giving. So all of those are really here, and obviously we're working on many more, which we're excited to talk about later if we continue, as we continue through our partnership. But we have programs from Love is Louder to Press Pause, Half of Us, Seize the Awkward, and JED Voices. I won't go too in depth here. Sorry, let me admit someone else. I'm lagging a bit. So if I'll just try to keep going. But if I get too laggy, we'll just have to figure out the host situation, because I think it's because I have too much going on my work computer. But
Jess, I can admit people while you're speaking, and then if you do the same for me, so you don't have to worry about that.
Perfect. Thank you, Susie. I'll just go over briefly at the Seize the Awkward campaign. This campaign was in partnership with the Ad Council and AFSP. And I think it's really one of our most meaningful campaigns, because it really puts a lot of onus in the students' hands and the youth's hands, and says, here are some signs to notice when your friend is struggling. And here are some conversation starters to have to start that first outreach to your friend, and say that, hey, how are you? Are you okay? And if it ever is so bad, we also encourage students to help make that referral to a trusted adult. But what I love the most about Seize the Awkward is that it's putting so much of that ownership into students' hands. And then it's also allowing students to notice signs within themselves, because they're able to identify those signs in other people. They're now able to identify it within themselves and say, oh my gosh, I'm not doing well. Let me reach out and truly seize the awkward, as the campaign states, and help a friend or myself when I'm in need. And if it's getting to be too much, how to make that referral. Who is that trusted adult that we could go to, whether it's yourself or a friend, when you're really, really struggling. And so here is a brief little snippet of the website. It is been revamped twice this year, which we're super excited about. It was revamped to be very sensitive to our conditions during the pandemic. So it was made to be a little bit more virtual friendly. And then it was revamped again this past September, a complete relaunch with new images, new videos, and every new conversation starters, because what we do know is that students or youth are changing every day. What they like are changing every day. The way they would start a conversation is changing, and we really want to be relevant with the time and make sure that if we are promoting any kind of program that's encouraging students to reach out, We want to make sure that we're giving them those words that are in their lexicon, those things that are relatable and they feel comfortable moving forward, instead of giving them something that maybe we would be comfortable moving forward with, having that first conversation with a friend who's struggling.
So we're going to talk a little bit about our JED campus approach. The two approaches, JED campus and JED high school, are not dissimilar, but they are bringing a public health approach to two different developmental populations. So the JED campus approach, and as Jess said, we are now working with about 300 colleges across the United States, is focused on empowering colleges, campus systems to work internally to enhance student mental health, substance abuse, and suicide prevention efforts. The way that works is that a campus signs on for a 4-year collaboration with JED and the campus. JED helps the college do an organizational assessment and also a student assessment to take a look at what it's doing well and what it could do better around strengthening mental health, substance misuse, and suicide prevention systems. And then JED helps provide a framework through feedback reports, strategic plan, and ongoing technical assistance to help the system itself set its own targets and make its own improvements. And we help them measure, we provide assessment support and feedback along the way. And so our 300 colleges now have impacted almost 3 million students who are members of those college campuses. It's really important, as Jess was talking about earlier, you remember that slide that she brought up that talked about people of color somehow not experiencing the college world as quite as supportive, excellent, or good, quite as safe as people who are white, right? And so one of the pieces that we've brought into our work is JED's Equity and Mental Health Framework. And this is a framework that says, we understand actually that students of color, and this is going to be true on the high school side too, there are some concerning differences between students of color and white students around mental health, well-being, and suicide prevention, right? And so what we want to do is focus in on making sure that we are supporting students of color in this systems evaluation work. So we're looking to specifically set a campus-wide or a school-wide, if we're talking about high school, priority of identifying and promoting the mental health needs and the well-being needs of students of color. Engaging the students themselves to help us understand what do they need, what are they getting, what's their guidance and feedback to us, right? Jess was talking about how important it is to listen to youth voice and speak to youth voice, and our equity framework does that as well. And to make sure, as Jess mentioned, that we're actively recruiting and training a diverse, culturally competent faculty and professional staff. So the young people on campuses or in high schools, when we get to that program later, have that, they're not invisible. They see themselves reflected in the people around them, and they have those supports available to them. Creating opportunities as part of this framework, right? Engaging students around national and international issues and events, and actually specifically creating a role in the system to support the well-being and success of students of color. Making sure that the response system of campuses is safe, supportive, and accessible, right? And offering diverse supportive programs and services in varied formats. One of the things we know is that one of the differences between the effectiveness of our systems for white young people and people of color is that actually we tend to offer cookie cutter approaches that aren't necessarily culturally responsive or competent. And so we want to hear from young people, what do you need? And we want to offer supports in a varied format. We want to help students learn about programs and services by thinking about advertising in and promoting in the channels that they go to. And that is not going to be the same for every student or every group of students. And we want to specifically pull in programs and practices to support mental health and well-being that have been proven or are promising in terms of their capacity to be culturally relevant and effective for students of color. And finally, we want to make sure and create a community, and our equity and mental health framework does that, of schools that are working to boost up those supports for young people of color and have them share resources and information so that knowledge dissemination is strengthened as well. So we're going to walk you a little more specifically through our campus protocol, right? So as we mentioned earlier, it's a 4-year protocol for campuses. High schools, it's a little bit shorter, right? But on the campus side, we start out with an assessment process. Now that assessment process starts with the campus themselves building an interdisciplinary team. That team we advocate is built of people from all over the campus, not just leadership. That team participates in an organizational self-assessment. Meanwhile, the school participates with our University of Michigan partners and administers a Healthy Minds student survey so that we get both the organizational evaluation of itself and the real deal from the students on how things are going. The results of that assessment are fed back in a report, and then the organization creates its own strategic plan. So again, what's unique here, and this is true on the high school side as well, is that we're not looking to come in, evaluate you, tell you what to do, right, and then walk away. We're looking to come in, help you build a team, self-evaluate, build upon your strengths, and choose your own priorities for what you want to improve and work on next. Once that's all done, on the campus side in years 2 and 3, we move into an implementation phase. And you're assigned a specific campus advisor. If you're college, on the high school side, it would be called a high school advisor, who supports you through technical assistance to develop your plan and then implement your plan. And the exciting piece too is that once you've gotten to this point in planning and implementation, you become eligible to access what's called our campus playbook. We also have this on the high school side, and these are constantly updated and well-vetted resources for campuses or high schools to use to bring in the tools that they want to bring in or the resources that they want to bring in. So it might be sample policies, forms, learning resources, mental health services and recommendations, you name it. It's in there, right? Throughout that whole process of implementation, the JED campus advisor and the JED team are helping by providing feedback and support along the way. Then the schools move into a learning community, right? And that learning community is, again, another place where the campus is participating in conversations with other campuses across the country. There are regular webinars, newsletters, and so this develops another level of support, right, where you're sharing your best practices and you're learning. And certainly what we've seen with the pandemic is that these learning community events have helped people even just care for one another and get through some of the crisis and decision-making that had to be done fairly quickly moving through the pandemic. For campuses, at the end of year 4, we conduct a formal evaluation, a final evaluation that sort of lets campuses see where they've developed systems and where they've made progress. And then year 4 also focuses on sustainability, cementing the structure of the interdisciplinary team, setting future goals, and staying engaged as what we call a JED campus alumni in the learning community and ongoing access to that playbook.
This is an image actually from one of our JED campus programs called from Virginia Commonwealth University. And I really like to show this because while we come in and we work with you and any other organizations or institutions that you're working with, because I always say we're not in the art of competing, we're in the art of supporting and collaborating and building even more community. This particular image was sent to us last year from this JED campus, where they created this to be put on across their entire campus to really show what they've been doing and how students, or I guess I actually don't know, I guess it's a RAM, obviously. the RAMs can support other RAMs. I'm assuming that the RAM that has the umbrella could be a peer, or it could be an educator or a staff member. But the point is that we were saying to the school, we need a little bit more imagery around where students can go for support across your campus. Any kind of programming in that way that's very passive, but it's noticed by students, can always be helpful. It doesn't always have to be through active efforts such as like direct counseling or direct trainings. These are some, this is an example of how a school has really taken some passive ways to let their students know that there is help literally all around them, and they want to make sure that they're getting the help that they need. And this is just not a comprehensive list, obviously, but a list of quite a few of our JED campuses that we've been so fortunate to work with and to work for. We have a cohort of schools that we work with in Washington State at this time. I don't have a comprehensive list, but we're just happy to know that through working with any schools in the Washington State, as high schools, as a high school team, we know that we're going to help create systems in various high schools throughout the state, but also that those students that are getting these services through our programming could then move forward and go to a JED campus where they can continue to work on their emotional well-being and their mental health. And they're encouraged and supported by staff and faculty that really understands the importance of this kind of support.
Now we're going to switch a little. We've talked to you a lot about our campus programming, and as Jess said, that was our flagship program. But these days we're in the business of really expanding our work into high schools. As you all well know, because you're working in the secondary, and some of you, I think, the primary education environment, what goes on in the high school years is a significant predictor of what's going to happen in the young adult years, right? So we know that the social and emotional well-being of teenagers predicts how they're going to do in school, how they're going to do in learning fundamental life skills, and also how they're going to adjust to whatever pathway they choose in terms of young adulthood. So as I think Jess was mentioning this before, right, one of the things that triggered JED's expansion into the high school environment was looking at some of this information. And again, this is pre-pandemic also. We want to really be thinking about how this might be different now. When we talk to first-year college students, right? So this is just the college population. I'm sure that if we had a parallel survey for the working world young adulthood population, we'd see these numbers as well. About 77%, that's a huge number of young people, tell us that they think that social media, television, and movies make college seem a lot more fun than it actually is, right? 63% are constantly touching base with their parents about how they're adjusting to this new lifestyle, right? So that tells us something. They're sort of sonaring back to their caregivers and their families to get help and support. And there's nothing wrong with that, but we just want to make sure that families and caregivers are prepared to give that support. 45% feel that others are figuring it out and they are not figuring it out, right? That freshman year particularly is so challenging. 49% say that college isn't living up to their expectation. They're somewhat disappointed in what they thought college was going to be like and what it's really like. More than half say that making new friends is difficult. And this is the most important statistic. 65% of these kids who are really feeling this level of challenge are telling us they tend to keep that to themselves. They don't feel comfortable letting anybody know that they're struggling.
So going off of what Susie was just saying, that survey was conducted with first year college students, like she said, and we knew then that, well, we already knew, we just wanted to support our knowledge with evidence, right? We just didn't want to go in and just do whatever. But we created Set to Go, the program that I mentioned earlier, which is absolutely and utterly about promoting student well-being, and making sure they're emotionally prepared to transition out of high school. Whatever they decide to do, whether it's college or workforce, we want to make sure that they are able to really focus on transitions and dealing with those transitions in the healthiest way. We have resources on our Set to Go website for not only students, but also for families and educators. I've said this a few different times in this presentation. I say it all the time in my personal life. Susie has said it sometimes in this presentation as well, is that it really takes a village. A student can take on this work themselves, which is obvious, but it is better to have a support group. Your ecosystem around you should understand the importance of supporting you mentally and emotionally. That transition of leaving the home, in some cases, leaving the home and going into the workforce or into college is really, really difficult. It's like everything is starting anew. And while we focus a lot on academic preparation, which is important, we have to start focusing more on those emotional aspects, like identifying and managing your emotions so that you are better able to manage your relationships. We want to encourage students to start thinking in these ways so that when they do get to the first year college experience or their first year in their workforce, they are more ready for success. They're more well positioned to be successful. And just one thing that I'm thinking of on the top of my head is just that when students are not emotionally prepared for this transition, they are more likely to engage in risky behavior. They are more likely to have leaves of absence when they are in college or quit their job. And we don't want that. We want them to be, like I said, well positioned for success, regardless of what challenges arise. So some of our key resources on the Set to Go website that we have promoted in a variety of different ways through partnership and then just on our own is that we have an online resource center full of information for students that are transitioning out of the high school. We have a Right Fit quiz, not a worksheet, but a quiz where students can go into our portal and just see, okay, well, I'm thinking of going to this school, but does that school that I'm thinking of, given my immediate or not so immediate need to be emotionally prepared or emotionally supported through a counseling office, do they have a counseling office? Believe it or not every college has a counseling center. And if they do have a counseling center, how long is the wait time? Is there a requirement for insurance? These are all things that we're asking for students to really think about as they consider what school is the right school for them. Not so much a school that, you may have, you may be a legacy, or a school that, well, my friend is going there, I want to go there too. Not writing off those schools, but making sure that the school that you're going to is the right fit for you and will most likely promote success in all different channels when you're there. Starting the conversation is a guide so that families can further support their students as they're considering signing any release forms or information. This is really big for JED because our founders could not get the information their student or any information around what their son was going through up to those months before he lost his life. And that's really something to think about when you go to college and you hit that age of 18. You're no longer able to relay information to your parents. They don't have access to certain things. So it's really important to start having that conversation. And then the transition of care guide is really, really important for any student that has a pre-existing mental health condition or physical health condition. You're not going to be going to the same physician, most likely. You won't be going to the same specialist. So you need to figure out who on your campus or in the surrounding community would be the best fit for you to continue your health care. And so we really want students and their families to sit down and think about these things before they transition into the workforce or into college. And so here we are with the JED High School program. We knew that Set to Go, while an excellent resource for students, their families, and educators, we couldn't stop there because that was such a small slither when thinking about the overall mental health and supporting mental health of students in this particular age group in high school. So we have worked really hard to create a comprehensive approach that is suitable for this age group, and one that would be well received by educators and staff in the high school setting with our support. We have learned through surveying, we have learned through research that we cannot just continue to be like a lot of other institutions, all well intended, of course, and just give you information without providing some of that technical assistance that we know is needed, not just in the college setting, but specifically in the high school setting. So we've created an 18-month collaboration. It's actually 24 months when you consider pre and post assessments. But this 18-month collaboration is between us and key stakeholders in your school. And when I say key stakeholders, I'm talking about educators, I'm talking about staff members, I'm talking about parents and students, and any other organization that's bringing mental health programming into your school. We want to work with them, we want to collaborate with them, and we want to build a sustainable program that is really going to affect change. And so I mentioned before that it's 24 months because of the assessment tools that we use. We'll talk a little bit more about what those are in just a few slides, but they really look to see what is existing, what is missing, and where are there misalignments with what students are seeing versus what staff are seeing, and really thinking and thinking together on how to build the best strategic plan around how to build better or more thoughtful systems that support everyone in the community, specifically students, but also the caregivers, because you deserve that support as well. And then lastly, we have our online resource center and learning community that we provide schools after they reach a certain point within their strategic plan, which we'll talk about in a little bit, or if we have time for questions at the end, we'll go over that a little bit more in detail.
So it's important to think a little bit about what Jess was just saying, that this 24-month approach, or 18 school months and some months for assessment, is not about coming in and telling you what to do. We actually had a call with a school district in Washington State last week, and the superintendent said, Jed walks along beside you. And I loved that. I want to steal that from him, because the idea is that we take this comprehensive public health approach to social and emotional well-being, mental health care, and suicide prevention, and we help you take a look at what you're doing well and what you'd like to do better. So if you take a look at the wheel, it's sort of similar to the one you saw earlier for the campus programs, but I want to go through it with a little more detail. There are 7 core domains, and within each domain, schools want to think about their systems, processes, procedures, and resources, right? Not only what they're doing, but what capacity they have, right, to develop life skills. So first of all, right, we're talking about that tier 1 approach. What we know is that life skills, and in this we're talking about both fundamental life skills, just how to manage yourself as a young adult, and that ever so important social and emotional skill set, right? What are we doing to develop life skills? It's important to note here that life skills education for teenagers is very different than life skills education for younger kids, right? The research is now showing us that some of the reasons that educators can struggle with this, or high schools can struggle with this, is that we tend to be using the same approach we use with the younger kids. It's an add-on, it's a course, it's something that, you know, I have teenage twins at my house, and they might roll their eyes at some of their social and emotional coursework, right? So we want to help schools integrate life skills into education into the day-to-day environment. The next sort of pie slice or spoke of the wheel, depending on how you think about that shape, is what schools are doing to develop social connectedness and positive school climate. A couple of important things about this, right? We know that the more connected kids feel to one another, and the more connected they feel to their school, the more powerful our educational outcomes, right? Direct links between these variables and achievement. But we also know that a positive school climate, a safe, supportive school climate, helps prevent substance misuse, helps prevent mental health challenges, and helps catch kids early when they are struggling so that they can get help. The next piece of the wheel is about encouraging help-seeking behaviors, right? And so we know that adolescents are notoriously poor help seekers, right? They just don't reach out in the way that we would like them to do, given the level of stress and challenge in those 4 high school years. And so we help schools evaluate their systems and develop systems for reducing shame and secrecy so kids can reach out. So this can include, right, helping kids understand mental health literacy, but also helping them understand how to reach out to a peer if a peer is struggling. We also want to think about early warning signs. And so this is where you've all heard about gatekeeper training. That's where this comes in, right? And we know a lot now about effective gatekeeper training for teenagers. Again, no surprise, younger teenagers, adolescents, they have particular needs around gatekeeper training. We want to make sure and think about things like anonymous reporting mechanisms, fear of disciplinary action if they tell somebody that they're worried about a friend and their friend's going to get in trouble, right? We also want to understand that they don't always have faith that someone's going to reach out to them and that something's going to be helpful if they either say they need help or they tell someone that a peer needs help. The next spoke of the wheel is a really tough one. It's promoting access to relevant mental health services. And this, I know for you all, is probably one of the toughest. We've had some calls with your leadership, and we know this well from our work with rural schools, right? That promoting access to effective treatment for teens has many barriers, including the handoff process, the buy-in of families and the youth themselves, but also, do we have culturally relevant, culturally competent, effective care providers available to us where we are when we're very far away from the nearest urban center? And so we're really working to generate a roadmap for creative ways to incorporate effective mental health treatment resources into high schools. And then finally, the last two are when we start to move into tier 3, right? We're looking at treatment access, but we're also looking at making sure schools have really solid crisis management procedures, right? We know that responding to a crisis happens best when we've anticipated what a crisis might look like and we've set up a good structure and procedure for that. And finally, for suicide prevention, there's nothing more powerful in the research than means prevention, right? And so when we say creating a safe environment, we help schools look at their own physical environment and also possibly communicating with families about restricting lethal means at home. The one other thing I want to say, sorry, can you back that up for me, Jess? Sorry. Right, we talked about strategic planning, that we help you evaluate your system on all of this and set a strategic plan. But remember that equity and cultural humility frame. We're also going to help school systems take a look at kids of color in their school, LGBTQ plus kids, right? Groups of kids who English language learners are another example that are frequently groups of kids in rural environments that we want to take a special look at and make sure we've got effective, equitable care and supports for those kids as well. So let's talk a little bit about the process, right? We have some key aspects of the process that we bring to bear on our work. And this is work that these are elements that we've learned from the campus approach, but also that we know from the research on successful program improvement are critical to making progress in our high school approach. The first is supportive senior leadership, right? So we are definitely encouraging superintendents, principals, assistant principals, right, to work with us, understand our mission, and gain their buy-in and support. A commitment to strategic planning, right? We often hear from the schools that we're working with that People like Jed come in, they tell us what to do, and they go away, and then we have the same problems we started out with. So ours is not a come in and do things to you or for you, but an evaluation and strategic planning process through which you decide what you can work to sustain within your own system. Importantly, we want to communicate the shared vision that student well-being is everyone's responsibility. So Jess mentioned earlier that critical interdisciplinary team that has stakeholders from all across your school or your district and includes your community partners, right? That really starts building that vision that well-being is everyone's responsibility, not just the counseling staff, not just the mental health professional, but everyone in the school community and really the surrounding community. And then finally, right, diverse voices participate in the process. And so that committee and that evaluation process, at every step of the way, we're working to make sure that those two elements of the approach include all of the important players, right? Jess likes to tell the story of the cafeteria lady that she spoke to when she was in high school, right? That was her go-to. My go-to was Miss Diana, my drama teacher, who was a very flaky but very sweet and supportive person who I could go to when I was worried. We never know who a child or a teenager is going to trust or go to. So we want everybody at the table. And we also know that for teenagers particularly, community partnerships are really important. And you all know this because you're working in an alliance format, that we can really share resources and we can engage more young people and their families when we incorporate important community partners. So we have some measurement and evaluation as part of this process. And the nice piece of this is we try and make it as painless as possible, right? So we sort of have learned a lot. I've worked with a lot of schools in my time, and I know that you're not exactly sitting around twiddling your thumbs. So we want to make the evaluation process fairly elegant for you. So we do a few things. We have a fairly short pre and post organizational assessment, which the interdisciplinary team conducts, looking at each of those aspects of the wheel, seeing what's in place, what's the quality of what's in place, that sort of thing. We also have a partnership with the University of Michigan Healthy Minds Study, and they work with us to help you administer a survey directly to your students. They give you the links, you help your students complete the survey, and then they give us the data and we give you a report of the data. We also take any data that schools collect themselves. Some schools participate in YRBS, some schools have their own internal surveys or reports or information that they have to collect for their state or region, and we'll take any of that from you and we'll take a look at it, analyze it, and incorporate it into your feedback report. The other piece of our evaluation process is that we're periodically collecting information from you as we go along. So the pre-assessment happens, your strategic planning process happens, and then your high school advisor, who's your technical assistance point person, will keep track of progress that you're making on your strategic planning progress over time and continue to give you that feedback. And that can help keep a team moving forward and keep you going. And then finally, at the very end, after those 2 school years, those 18 months, we'll complete those first 2 evaluations again, that organizational assessment and that student survey. So then you really get to groove out on the progress that you've made as a team. So I'm going to talk a little bit on about the high school assessment. This is a self-study, so we can't emphasize enough that interdisciplinary team has to do this together, and it has to represent the voices of everybody at the school. It doesn't have to be everybody at the school, but you know as well as we do that coaches, cafeteria ladies, counseling staff, and teachers all have different prisms, different views on different kids and on campus life. And so we want everybody's voice represented at the table. You also can give us your policies and your procedures, and we'll take a look at those as well. And the evaluation itself is about 62 questions. They're focused on that wheel of the comprehensive approach that we just described. And they help you take a look at what your best practices are, where you don't have resources yet, and where you have practices that you might want to shore up when you compare them with what we know is most effective for adolescents.
And lastly, we wanted to just mention a little bit more about the Healthy Mind study. And this, like Susie was saying, is a study that will be disseminated to all of your students at your school, where we really look at several different areas. And we've recently added another area that focuses on the pandemic specifically. But we look at overall, obviously, mental health, whether students are struggling with depression, anxiety, self-injury, or suicidality. We also look at their lifestyle and healthy behaviors, such as their help-seeking behaviors, their help-giving behaviors. Are they engaging in risky behaviors? We look at their demographics, social and emotional health status, knowledge and attitudes about well-being and well-being services. So, for example, if are these resources that are provided to me within the school trusted resources for me? Have I felt that as a student, for example, or as an English language second or ESL student or English as a second language student, are the services in a different language? If maybe I don't have the best proficiency in English. We also think about peer influence and upstander and bystander behaviors, the school climate. Is it a really stressful institution that's focused on, GPA, test scores, what college you get into, instead of looking at the emotional well-being of students and how to really help them navigate these challenges? And then we also look at diversity and inclusion. I'm not going over these two in depth because of time, and I think we're almost at time, but I can, my information is always available. You can always reach out to me or Susie should you have any questions or want to talk a bit more about how to get involved in our programming. So I'm going to briefly go over this. These are very much like what you saw through JED Campus, but shortened, a lot less time. Like I said, 24 months as opposed to 4 years. We start with the assessment with the interdisciplinary team and disseminating those two tools to both your students and to your staff. After we've collected these resources and we built a report, we then sit down with you to figure out what are the best ways to build a strategic plan. That strategic plan will cover all of our domains. So for instance, you could have 3 action items in the area of social connectedness, but maybe just 1 in the area of crisis management response, because you've already done so many great things and you already have so many systems set up to anticipate any crisis ever happening. We then move forward after building that strategic plan. We then move forward with how we implement it within your school system, within your school community at large, and what that looks like with the help of your JED High School advisor and providing you those check-ins and ongoing technical assistance. How often would you prefer to check in? Would you like your entire interdisciplinary team to be there, or would you just like a few of your co-leads from the team to be there? It really depends on what you prefer. But we are obviously ready to help in whatever way possible. But after you've gotten to a certain point within the strategic plan and implementation, then we introduce you to our learning community. And that's where you have access to webinars, to high school newsletters, to different stakeholder groups or gatekeeper groups that really just allow you to share promising practices with other people that are involved in the JED High School program across the country. And then at the end, we will disseminate those 2 surveys again to really see if there's a change in attitudes amongst your students and amongst your staff. Are there changes in behaviors that are notable that we would like to share with you? Because I think all behavior change is notable. If you've ever studied behavioral science, we take any little bit and we count it. So any little bit, I believe, counts, because anything is an inch closer to providing a student with a good support system around their emotional health and their mental well-being. And any inch is a bit closer to helping caregivers give even better care for themselves and those that they are responsible for. And then this is just a little overview of what you could anticipate in some of the webinars in our learning community, such as suicide contagion, training on identifying an intervention for struggling students and engaging faculty. How does that look? How would you engage faculty? I think it would have been ideal, and we've had some things like this in the past, particularly this year, but how do you engage faculty over Zoom? That's not easy. Everything has been virtual, but how do we do it in a way that it's not so exhausting, that we're not adding to Zoom fatigue that so many of us are facing right now? So these are just a few of the things that you would get if you were to work with us through our JED High School program, or if you're looking just to employ some of our campaigns in your school, we're happy to do that as well. But we're here to support emotional health. We're here to prevent suicide. We're here to do it all within our scope, but really just give back to students and their communities of care. So I'll stop sharing. Kevin or Kim, I don't know if you're on. I don't know how much time we have for questions at this point. I know that you probably have, I think, another session after us. So I just wanted to see like what we could do at this time.
So Jessica, we just probably have just a couple minutes for questions.
Perfect. I don't see any in the chat, but if anyone has any questions, I'm going to actually put my email in the chat. If you don't have questions now, or if you have questions now, either is fine. And feel free.
I was just wondering how easy it is to actually get students to initiate conversations related to this. Like once you've asked the awkward question and said, "Oh, I'm just wondering if you are okay." I'm just wondering if there's like resistance still there for them to actually follow through.
Right. I mean, I think there's always going to be resistance in some ways. I think some people may be reluctant to have the conversation, maybe because of how the conversation was approached in the past. There's a variety of different things that can happen. I will let Susie speak more to like maybe a clinical piece of that, since I'm more of like a public health practitioner. But what we do say in our Seize the Awkward campaign is to don't force the conversation, but to let the student know that you're still there, to provide, share that you will be checking up periodically and follow through with those checkups, just to build that trust and let them know even more you're there, you're willing to listen, and that you're a trusted adult.
And look, we all know when it comes to teenagers, they don't always make it easy, right? They don't make it easy for us to ask them how they're doing. They don't make it easy for us to reach out. And so, of course, you're going to see resistance when you reach out to adolescents. It's who they are. It's how they do it. What we're talking about, though, is creating a substrate culture in which if they are struggling, they don't feel so stigmatized because they understand that it's fairly normative to have some kind of emotional challenge when you're a teenager. And also they understand where they can go for help. So it's a little bit like the safe space culture. The more that the important people in their lives are setting the example of being open, setting the example of self-care, setting the example of reaching out, the less likely it is that teens are going to be completely resistant to the idea of responding to someone reaching out to them or of seeking help themselves. So we're really talking about building the whole environment up to make it more likely, right? And so adults reaching out is one component of that environment that's really important. The other piece, as Jess mentioned, is that young people come to us with all kinds of experiences with systems. And so our initial pass at reaching out to them may or may not be received well. But we like to say the adults who are working with kids, try and try again. And it might not be you, it might be a different adult who could reach out in a different way. Say you reach out to a kid and you get resistance. Find out who that kid connects to, who that kid cares about. Tag that adult, tap that person. Find out what church that kid goes to and call that minister, right? There's always someone who a kid can trust who can reach out to them.
So true.
Okay. Well, thank you, Jessica. Thank you, Dr. Button. If you want to reach out, you can always reach out. I believe that on the On the agenda, you have Jessica's email. She provided it in the chat room. You can also reach out through us. We just really appreciate your expertise today. In my experience, I'm just speaking from my experience from the superintendent's experience, mental health was such a tough subject for a school district to find expertise and to even have conversations about. And really the conversations themselves really didn't exist until probably the last 5 or 6 years. So we do appreciate you being with us today and talking about a subject that personally I've really struggled to gain knowledge in. So we thank you for that, and we will reach out to you, and good luck in the future.
Thank you
Thanks,
so much for
everybody.
having us. Have a good day.
Be well.